how often is your day interrupted by an emergency, like trauma, heart attack, stroke?
Like a true emergency that's dying right then?
Mm-hmm.
I won't have one every shift.
Okay.
But most shifts have, I would say on average, one, would die, within the next few hours without intervention. And dying imminently in the next few minutes, every couple of shifts. We're coming in already dead and, what we call a code, maybe once every few shifts.
Mm-hmm. Yeah, and so that code, that's kind of the theme of what today's podcast is going to be about, and kind of what you do, what is involved, and kind of what are some of the decisions that people need to make ahead of time, actually, to have the best possible medical treatment that they can get that's in line with, their needs and wants. When someone's heart stops, the code that you do CPR, defibrillation, breathing machines. These are the things that are done commonly, right?
Yeah, I think, it's important for your listeners to understand, like, when I say in medical jargon, I am running a code, that means that someone's heart has actually stopped. And so, another word for that would be a cardiac arrest. Mm-hmm. And what we're doing is a whole bunch of measures to try and restart the heart again. Someone's technically dead at that point. And then we're doing a bunch of things. CPR is one of them. So the chest compressions, giving some very strong medications is another, to actually try and get pulse back.
Mm-hmm. Yeah. And so when do the breathing machines come in?
Well, they come in during this whole thing. So, if I can paint a picture, often if I'm in the room during a cardiac arrest, I'm standing at the foot of the bed and I'm, giving commands to give various medications. There might be 4 nurses in the room who are taking turns doing CPR and delivering these medications. And then since we're at a big center, we're lucky we usually have a respiratory therapist who's standing at the head of the bed. And while I'm kind of running the show at the base of the bed, they're kind of at the head of the bed and they're putting in an endotracheal tube. And they're usually not connecting them to a breathing machine yet, but they're having to breathe for them. So they'll stand there with one of these bags that you can press and it puts oxygen into their lungs. But realistically, after they come back, if you get a pulse back, people don't often wake up. There's brain damage and they have to go in a breathing machine to the ICU for quite a long time after we get a pulse back.
Thanks for checking out that video. I hope you liked it. Here are a couple more for you to check out. And if you haven't done so, please subscribe to my channel.